Hello people, now in this video let us look at this question that has been asked. Draw a neat labeled diagram of hilum of right lung. So they are talking about lungs here. Let's get the context right. So here they are talking about the hilum of the right lung, correct? So this is how right lung will have two bronchus. So they're asking you the hilum. Hilum is this root. So root of the lung, what structures are there, they want to know. Okay, they're asking for neat labeled diagram only, and they're asking it for 3 marks. Okay, so when was this question asked? This question was asked in 2003 November. Okay, very recently. So, and it has been asked for how many marks? 3 marks. Very good. Now, if you look at the lung hilum, and let us focus on the right side one only. Okay, right lung. So basically, how the right lung is looking from the medial part of it, if you see how it is looking. So basically that you have to draw. If you can draw as many diagrams, that is good. So here, this is right lung, medial view. You can draw something like this if you want. Okay, now this part you have to explain the structures. Only diagram they have asked, right? So now this is the diagram that you have to practice. Correct? So this is the only thing that they're asking for 3 marks. Now it is looking a little complicated, but it isn't. First of all, you should understand there are 2 bronchus, correct? Because it is right lung. Then there is a pulmonary artery which will take the deoxygenated blood into the lung, and 2 pulmonary veins will exit. This you know, no? When you draw heart also you know that it will be 2 from each lung that comes into the heart, correct? So this is to exit, you have to show, that is pulmonary vein. But here vein will have what? Oxygenated blood, you should remember. Then you have the supply to the lungs itself. What is the supply to the lungs? Blood supply? Bronchial artery and bronchial vein. Okay, on the right side you have only one artery and one vein. Okay, the nerves you should have. So anywhere you go you will have what? Artery, vein, nerve, lymphatics. So now nerve. Okay, nerve plexus you have to write. In that you have anterior and posterior nerve plexus, and then you have to show some lymph vessels and lymph nodes. So shall we try to draw now? Yes, of course. That is what is the That is what the question is, to draw. Correct. Very good. So let's draw. So here we have to draw a beautiful circle with a question mark type. Wow, it's coming well. I'm drawing in paintbrush actually on my laptop. Okay, so this is how it is. Some extras I have to remove. Okay, quickly let's draw now what? 2 bronchus. 2 bronchus please. For the air to enter and leave. Very good. 2 bronchus done. I think both circles could have been same size. Okay, 2 bronchus done. What else you need? Blood. Deoxygenated blood coming in. Very good. Pulmonary artery. Very good. Now you need pulmonary vein. Pulmonary vein. 2 of them has to exit from this right lung. Very good. Then nerve plexus. Anterior and posterior. But before that we had to do what? The bronchial artery and vein. Just put one bronchial artery and bronchial vein, because the lung also needs blood supply. No? Correct. Bronchial artery and bronchial vein done. Now what we want to do? Nerve plexus. In nerve plexus what you have to do? Anterior and posterior. Okay, so this will become posterior. This will become anterior. You're understanding, no? Because this side is anterior, don't forget. And this side is posterior. Okay. Then label neatly. Now, what else you have to show here? Some lymphatics. Very good. For lymphatics, what color do you use? Purple. Purple is good enough for you. Here and there some lymphatics, and label them as lymphatics. Okay. Have you drawn everything? Yeah. Label this as lymphatic vessels, lymph nodes, like that. Okay. That's it. So this is right hilum. This much should be giving you 3 marks. Okay. If you want, they've asked for 5 marks, then you have to write about it. So you just say that it is the medial surface of the lung, that's towards the mediastinum. It is having structures which enter or leave the lung, and it is at which level? 5th, 6th and 7th thoracic vertebrae. Remember, 5, 6, 7 thoracic vertebrae. So we'll say T5, T6, T7, that level it is there. Then what else you should know? Down here, no people, there is something called as pulmonary ligament. Okay, label this also people. And don't forget to say this is superior, anterior, posterior, and say this is right lung, medial side. All that you should say. Basic, that architecture, elevation, which view is it, front view, back view, all like that, how you'll write. Like that here you should say this is anterior, This is posterior, superior, this is inferior, all that you should write, okay? Now coming to the contents we already told you. Then areolar tissue, okay? They have written on areolar tissue here, you can add that also. Arrangement of the structures from this side to that side, from posterior to anterior, they have given. If you want, you can look at that. For me, this diagram itself says what is posterior to anterior. Same thing you can repeat if you want, okay? Please practice this diagram. Now coming to the clinical importance, you have to always write clinical importance at the end of every anatomy question so that you will get some brownie points. So basically this hilum, the root of the lung, anchors the lung. That is why it is called as what? Root, because it anchors it. It holds this lung also. It anchors the lungs to the heart, the trachea and the surrounding structures. So whatever foreign object, usually what will happen, foreign objects will go inside the right lung. Why? Because the right bronchus is more straight and wide. Okay, the right bronchus is more straight and wide. That's what this says. Okay, so as it is more straight, the foreign body tends to go more into the right lung. Okay, the angle that it makes with the carina is smaller, the right bronchus. Okay, did I say everything that is required for you to get just 3 marks? You will get 5 marks. If for 5 marks if they ask also, you should be able to write. Okay, just one point I will add here. Okay, in case it is for left that they are asking. In left, no, the bronchial vessels, bronchial arteries are 2. Okay, just remember that, and there's only one bronchus on the left, but bronchial arteries are 2 on the left. Okay, then what else you should know? The angle that it makes. So if this is the trachea and that's getting divided like this as the right and left, with the carina, the angle of the right bronchus is around 25 something, right? And this is around 45 something. So the right bronchus angle is smaller. So that is the foreign body tends to go more into the right lung. Why? Because it is more straight than the left.